Hi there, I'm Mike Johanns, and let me just say welcome to today's Medicare Informational Seminar. Let me start off by saying thank you to all the Medicare enrollment experts who are here from various offices and agencies throughout the area. Without your expertise, today's seminar would not be possible. As you know, the Medicare enrollment process can be cumbersome and it can be confusing. These experts will help clarify various Medicare options available so that you're able to make informed decisions about your health care. Members of my staff are also in the room in case you need assistance resolving a dispute with a federal agency, whether it's related to Medicare or any other federal program. We're here to help. So thanks again for being here. I truly hope today's seminar is helpful, and I look forward to seeing you soon. God bless.
My name is Alyssa Balch, and I'm with the Centers for Medicare and Medicaid Services in the Kansas City Regional Office. We support Nebraska, Iowa, Kansas, and Missouri, and I'm delighted to be here today to give you some general information about the Medicare Open Enrollment period, which we're getting ready to enter, and then leave a lot of opportunity for you to ask some questions, because that's the most important thing that we can do for you here this morning. As I said, the Medicare Open Enrollment period will be starting shortly. It actually begins on October 15th and will run until December 7th. Any changes you make to your Medicare coverage during that time will be effective on January 1st of 2013. It's important during this open enrollment period that you take some time to review what your current Medicare coverage is to determine if it's going to be the appropriate coverage for you for the following year. I talk with people all throughout the year and they say, Alyssa, I like what I have this year. I don't need to do any changes. And I remind people that although they may like what they have in 2012, their plan that they're in has an option to make a change to their benefit structure for 2013. And that change may not work for you as well as what their coverage was in 2012. Again, we always encourage you to go out and do a review to make sure that you're getting the most coverage that you can for your dollars for the following calendar year. As James said, Medicare can be a complex and overwhelming program to try and figure out what is best for me and what maybe I shouldn't do. And unfortunately, we wouldn't be able to in an hour's time speak with all of you individually, but there is assistance that is available to you so that you can have one-on-one counseling with people to discuss your specific Medicare coverage needs. One option for that is with your state health insurance program, or SHIP. They are a state agency which every state has, and they receive federal funding from the Centers for Medicare and Medicaid Services. They're responsible for helping the citizens within their state with their Medicare options and enrollments. They are mainly comprised of volunteers that will sit down and meet with you one-on-one, look at what your current prescription needs are, and then help you evaluate the options that are available to you and enroll in them if you would like. They provide free, unbiased information about your Medicare enrollment and information, so you won't feel pressured like you would if you might see a sales agent. The best way to get in touch with them is to call them. They have a toll-free number, which is 1-800-234-7119. You can talk with them about different enrollment events that they will have during the open enrollment period, and you can schedule an appointment with them for that. Or you can maybe have just a counseling session over the phone and get some information that you need. But they're there for you to help you as you navigate through your Medicare coverage. Again, their number is 1-800-234-7119. CMS started mailing out the Medicare and You publications on September 16th, and I think I see a couple of people in our audience today that have already received theirs for 2013. Can I get a show of hands? Has anyone received theirs? Great. We are still in the process of mailing those. We do promise they'll be in your mailbox by October 15th, which is the start of the open enrollment period. With 50 million beneficiaries in the Medicare program, it just takes a lot of time to get those published and mailed out to everyone. So if you haven't received it, you should be receiving that soon. Another thing that you should have received by now, it actually should have arrived in the mail to you by September 30th, is your annual notice of change. This is a letter that your current Medicare Advantage or prescription drug plan is required to send to you every year. It is a letter that outlines anything that will change about that plan for the following calendar year. If there's a change in premium, deductibles, coinsurance, or benefits covered, including prescription drugs that are covered by that plan, those are going to be outlined and made available to you in that letter. If you have any questions about what's in that letter, if you're not understanding exactly what the plan is telling you, of course you can always give them a call and they can help talk you through what the changes are and how they may impact you. Or you can call 1-800-MEDICARE and talk with them, and they would be able to assist you in understanding what the information is that's in the letter that you received. Yes, we have a question.
Each year at September 30th, it's required to get.
The question was, is that every year? And the answer is yes. That's a guideline that they're required to follow, and September 30th is their deadline every year for those letters. Yes. Yes, ma'am.
Does that also include any supplemental plans, or is that just for the prescription drugs?
The question was, does that include supplemental plans? And it does not. That letter is only a change as it relates to a Medicare Advantage plan or a prescription drug plan. That requirement does not apply to the supplement plans. Great question. Other questions about the Medicare program or the open enrollment period that we're getting ready to enter? Yes.
Do we know what the change is in Medicare Part B?
The question was, do we know what the changes are for Medicare Part B? And I'm assuming you're referring to the premium amount and the deductible for the Part B if you're covered by original Medicare. At this time, that information hasn't been made available. So continue to watch for that information. Usually that's in November that they're going to release the information about next year's premium for your Part B as in boy benefits and what the deductible is for Part B. Do we have other questions? Yes, James.
How do we get that information in November about Medicare Part B?
Usually there's a big press release that goes out with that. I don't believe it's on the Medicare.gov website, or if it is, it might take some time to find it on there. But we can make sure that your office receives that, James, and then you can disseminate that to the constituents as you'd like. Some information just about your options that you have in 2013. There are 32 prescription drug plans that will be available in the state of Nebraska in 2013. 14 of those will have a zero deductible for them, and the lowest cost plan in 2013 will be a $15 premium. The information about the 2013 plans is available on the Medicare.gov website. If you're familiar with this website and our tool, the Plan Finder, you can go out and start doing a personalized search and seeing what your options are for next year, keeping in mind you won't be able to actually complete an enrollment until October 15th. Yes?
Who will carry that $15 plan, and is there a deductible?
AARP.
It's an AARP plan. I'm sorry, I haven't actually looked at the details of everything, but Houston did just inform me this morning it is an AARP plan. Are you?
It will have a deductible.
And it will have a deductible.
Is it a preferred network plan?
Yes.
Yes. We like to work closely with our partners, and Houston likes to fill in the blanks for that. So it looks like Houston has a lot of that detailed information and is another great resource for you guys as well as you're working through your Medicare options during the open enrollment period.
I have a question about the prescription drug plans. I know that during open enrollment, you
know which drugs are available for your plan, what's best for you. But as I understand it, last year, after January 1, some of the drug plans were able to make some changes. Is that true, or was that?
It is correct. Medicare prescription drug plans are able to make changes during the middle of the year. They have what we would call a mid-year formulary change that they would be allowed to do with CMS's approval. So if the change happens, someone at CMS has reviewed that and has approved that. It typically happens when new drugs come on the market during the middle of the year, like a new generic is going to come onto the market, then they may make a change to their formulary. And it's just how patents expire and how that works within the manufacturing environment that doesn't align nicely with our open enrollment period. If someone is impacted by a change with their formulary during the middle of the year, first it's important to know that your Medicare prescription drug plan is required to give you a 60-day notice before that change in their formulary. And that's if you have been taking that prescription when they look at their claims history. They won't notify everyone that's in their plan, but they notify those who have been recently taking the medication. Again, they need to give you a 60-day notice in writing. They're going to tell you what alternatives that they do cover that are similar to the medication that's being changed off their formulary. And you always have the right to ask for an exception. If they are removing that from the formulary and for whatever reason you need to be taking that specific medication based on your clinical needs and the medical impact that has, you can request an exception with your plan. They will review the medical information that is submitted by your physician, and they would either approve or deny that. At a certain point in that approval and denial process, if they deny your request, you do have the right to have that looked at by the independent review entity, which means a third-party person will take a look at the facts surrounding the need to be taking that medication, and they would again either side with the beneficiary or with the plan in that situation. Plans can make a change to their formulary though in the middle of the year. If they add to their formulary, beneficiaries aren't notified, but if something is removed from the formulary and you're taking that medication, then you should be receiving a letter from your plan.
It just didn't seem very fair to make the best decision you can during open enrollment and then it's out of your control.
I understand, and it's definitely a concern for people, but with the regulations that we currently have in place, they are allowed to make those changes. Yes.
I'm sorry, but I don't understand or know who CMS is, or what organization that is.
Of course, I'm sorry. CMS is the Centers for Medicare and Medicaid Services. We are the federal agency within the Department of Health and Human Services that is responsible for administering the Medicare and Medicaid program on the federal level. Keeping in mind that Medicaid is then operated by states, we ensure that states meet the federal requirements of the program, and then each state has flexibility within their Medicaid program that they administer at the state level.
Okay, and who administers it at the state level? Go with that again.
The state level would be your Department of Insurance.
Department of Insurance.
Usually a component within that is where your Medicaid services are within the state. Yes.
If I'm getting the emails from CMS, will I also get that letter, as you said that they send out?
You get emails from CMS.
I'm on email.
It depends.
I have an option to get those. And I get probably one a week.
And it comes from CMS, and usually in general the content is...
Any changes, different medications?
I would think that that's probably going to come from your Part D plan and not CMS.
I had an option. I'm getting...
When you enroll through the CMS website, you may have checked an option to provide information electronically and given your email address, but that information is shared with the plan. They would notify you if they make any changes to their benefit design.
But my question was, if I'm on an email list, do I get that yearly mail
The annual notice, no, for that one, they're gonna send that to you in paper copy, not electronically. I think we have time for one more question, and then I need to turn it over to Houston, but we'll stay after and take questions for you. Yes.
I was wondering, last year, I can't remember which cholesterol medication went generic,
Lipitor?
and it was a whole debacle.
Yes.
None of the drug companies would commit, and people got into drug companies that then decided it was like a tier 3, and they wouldn't cover it. Is there gonna be, are there any regulations or anything pending?
There's nothing that I'm aware of that's pending that would change any regulations that would address that type of situation that we saw last year. And it's something that we will see over the next several years, as there are several medications whose patents are getting ready to expire. It was similar to the woman's question in the back about doing a mid-year change. A generic became available in the middle of the year, which prompted a lot of plans to maybe remove the brand name Lipitor off their formulary and only cover the generic medication.
So besides switching to a 5-star plan, what is any recourse for?
The recourse that you would have is to ask for an exception.
If you don't get it?
You would have to stay with that plan through the rest of that calendar year and make a change during the following open enrollment period.
Thank you.
You're welcome. With that, I'm going to turn it over to Houston here, who I had the privilege of meeting this morning. We've talked on the phone several times, but I now have a face with the name, and he's going to share some information with you.
Well, thank you so very much. I appreciate this. I'm Houston Doan, and I'm one of many people with aging partners. Neil Sandoz, who is back in the back of the room, he's the other insurance and financial counselor. You've heard about what the program is, kind of how this program works. Now I get to tell you the really important stuff. What am I going to do? Okay. Prior to October 15th, you can either call, and there's a table over there with a card on how to get a hold of the state health insurance information program known as SHIP, and they are actually going to have a series of one-on-one clinics where you can sit down with a trained volunteer, go through your medications on this website, and choose a plan that would be effective for you starting January 1st. You can also call Aging Partners at 441-7070, and Zoe's going to give you more information on that in a minute. We also have one-on-one opportunities to sit down with Neil, myself, and volunteers to go over the medications you take and try and pick the best plan for you. Now, the program is complicated, but the best part about this program is since 2006, we have saved Nebraskans hundreds of thousands of dollars in prescription drug costs. And the neat thing is, and this is why it's very important to review your program every year, quite candidly, from one year to the next, we can save on the average $300 to $600 a year by getting everybody in the right prescription drug plan. Does it happen all the time? No, but many times it does happen. My best results, I saved a little lady $1,800 from one year to the next year by finding a more effective prescription drug plan. So it is very important to review those prescription drugs that you take every year. Now, someone mentioned the 5-star plan and what happens. You know, if a company does change your formulary in the middle of the year and you're stuck, and they've gone through the appeals process and they say, no, you have to take that drug, or you don't get to take the drug you want to take, but you have to use something else. Last year, for the first time, anytime during the year, you could switch your prescription drug plan one time to a 5-star plan. Now, a 5-star plan is a CMS rating that ranks the companies as far as their performance and how they're viewed. But it is an opportunity. I call it an ace up the sleeve, well, kind of half an ace up the sleeve, but it is another advance that CMS has made that is an opportunity if you find yourself kind of behind the 8 ball and need to make a change in the middle of the year, or something has happened and you need to get into a program that gives you a little more latitude. There was a question earlier about who administers Medicaid. In the state of Nebraska, Medicaid, unlike Medicare, Medicaid is administered by the Health and Human Services Division within the state of Nebraska. Okay. I think with that, I'll be here later if you have questions, comments, whatever, but no comments for me, just questions. Zoe's going to wrap up, I believe, and again, I want to thank everybody for showing up. Thank you.
Thank you, Houston. I'm Zoe Olson. I'm the marketing and PR person for Aging Partners. And we have a wealth of information for seniors. We are the Area Agency on Aging, and we serve 8 counties, including Lancaster. We produce television shows on City TV Channel 5 and Health Channel 10 on Time Warner Cable. You can also watch those online, and you can watch them on YouTube. And this month in October, Houston is one of the segments on our Live and Learn program talking about, of all things, Medicare Part D. And the representative from our SHIP office is also with him. We put out a magazine called Living Well. Do many of you get this? Okay. So you know there's a lot of good information. This is just hot off the press today. And in the back of the magazine, every issue, you find these, what we call the blue pages. Okay, and that tells you everything that Aging Partners does for you or that you can get information on in the 8 counties. And so we have information on being well, because we all want to be well. Today, we have our intern Jill, our nutrition intern Jill, and she can talk to you about, give you some information on nutrition. We'll also be doing Tai Chi and yoga demonstrations here and in this room after the presentation, and then there will be a health clinic. And if you don't know where the health clinic is, it's out those doors to your left. Yes?
Where does one obtain that magazine?
I will give you one, and then there's a subscription form in the back. Okay? Thank you. Planning ahead, Houston heads up that group. And so Medicare Part D, reverse mortgages, legal counseling, all those things, Medicare and Medicaid fraud. The ombudsman for Medicare and Medicaid fraud is housed in Aging Partners offices. Her name is Tammy Barrett. We have Staying Involved, which is the senior grandparents or senior companion program and foster grandparent program and the long-term care ombudsman. And then we have our senior centers. In the back is Bob Esquivel. Raise your hand, Bob. There you go. Bob's in charge of all the senior centers, and we have all kinds of things to do where you can stay involved. We publish My Center News every month, and My Center News has all the activities, things you can stay up with on all our in all our centers, as well as our day trips. And then we have also our menus that you can reserve a meal. And living at home, we do all kinds of support services for living at home. We have a care management services, we have the Lifeline Emergency Response System, supportive services programs, lots of those. And there are several staff members here. Anybody that works for Aging Partners, please raise your hand. They can answer all kinds of questions for you following the presentation. And then other services we do. We have transportation services. We have information referral, again, Living Well Magazine, the Live and Learn show. Anything you can think of, we probably offer it here, and you just need to call 402-441-7070, and we'll get you in touch with one of our experts. We are your area agency on aging. We give you unbiased information on anything that has to do with aging.
Scam artists are tricking seniors into giving their Medicare or Medicaid card number. Join the Senior Medicare Patrol to help yourself and teach others to spot false charges and report fraud. Protect your cards as you would your credit card. Never accept free offers or sign blank forms. And always keep and compare healthcare services you receive. Information available at 1-800-942-7830 or www.dhhs.ne.gov/SMP.
The pain will not control us. It will never break us, define us, or keep us still. Because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.